Good afternoon, Door County, Surgeon Bay. This is Dr. Jim Heise, Chief Medical Officer of Door County Medical Center. I just about forgot who I was. That's kind of been the way this day's been going. Once again, joined by Sue Powers. Welcome, Sue.
Thank you. I'm the Health Officer and Public Health Manager from Door County Department of Health and Human Services.
Notice how this week I didn't even try, because last week I screwed it up so bad.
It took me a while to memorize that full title,
Yeah,
so I don't blame you.
Well, I just want to thank everybody who's joining us. We were just trying to sort out before we went live what week this is, and I can't remember what week we're on. So who the heck knows? But looking forward to answering your questions. So go ahead and start doing that. I'm messing with my iPad here so that I can be ready for the questions. I guess, Sue, why don't we start with the usual update and let us know where we are.
Sure. So as of today, we have 2 more new positive cases, which puts us at 12 total for confirmed cases of COVID-19 in Door County residents. And our investigation of these last 2 cases is still ongoing, so it still has not been determined if there's community spread in Door County. And then unfortunately, we've had the second death of a COVID patient today. This was an individual in their 70s, and my heart goes out to the family and friends of this individual. We have 7 patients that by our investigation have recovered. So that number 7 is included in the, I don't know if I gave this, that we're up to 12 total diagnosed cases. We have had results, negative test results, 275. The total number of tests done on Door County residents is 311 to date, and so that leaves 24 tests pending. Maybe I'll talk about community spread, what that is, because I just told you we're not sure if there's community spread. And what that would mean is if I become symptomatic and get tested and I'm diagnosed with COVID, and I don't have a travel history to an area of prevalence of COVID, or I don't have exposure to a known case, I'm not sure where it came from, that would indicate that there's community spread. I think that's all for now.
Okay. Well, it's been, we had gone, I think it was 2 weeks we had gone without a positive. So we had had a good stretch without. And then I think it was last Friday, it sort of ramped up again, and we've had 3 positive since that time. So it just goes to show that this is continuing. And the light in front of you, by the way, is going off and on, off and on. So if you see you'll see why, you'll see the light brightening, just technical stuff. But so we've had 3 additional ones. But the good news is, and I didn't do the math before, but I always look at, I generally in my head or on my calculator will sort of do the rate of what is the negative rate, and what it comes down to is the number of tests that are negative and the ones that are positive. We're vastly more people that are negative than positive, so that's a good thing. The other thing that's interesting this week, and I just read this, and I actually wrote it down because I was curious about it, is Brown County now has the highest infection rate in the state. It even eclipsed Milwaukee and Dane County. So to give you an idea, this is in the paper, there's 299 positive cases per 100,000 people in Brown County. By contrast, Milwaukee County has 275 positive cases per 100,000 people. And that is largely, if not completely, due to the meatpacking plant that had the outbreak. And we kind of look at that outbreak as almost an object lesson as to how this virus works. So you have people working in close quarters in a meatpacking plant. One person, patient 0, comes in and gets sick and starts to infect others, and it very quickly spreads through through that organization, and then also backward to families when they go home. And the socioeconomic group that these folks are, from what I understand, they live in fairly close quarters. So same thing. So we went from having double-digit cases in Green Bay to now over, what was it, 800?
856 today,
Yeah,
so I think it
856.
was just about a week ago, they had around 35.
Yeah.
Not much more than a week, if that.
Yeah,
So it really expanded.
yeah. So, yeah, I mean, that really is, it's interesting to watch, I guess I'll say.
And it helps us all remember that we gotta follow the guidelines that we're all really, really tired of. The social distancing, the stay at home, only essential travel, wear a mask when you're out in public.
Yeah, yeah. You know, and I fully understand, because I'm one of them, people that are getting antsy and they sort of say, like you said, we're sick of hearing it, I'm sick of saying it. But at the same time, it is important because we know that it works. You know, in this concept of, I've heard some discussion bandied about how, well, you know, social distancing, if we do that, all we're doing, we're flattening the curve, but we're just extending the amount of pain we all have to do. And I don't think that's entirely accurate. I mean, I think, you know, obviously it will help and it has helped in our state. It has helped us not overrun the healthcare system. But at the same time, I do think it will prevent people from getting infected. You know, the big thing too, when we talk about overrunning the healthcare system, all of this quarantining and stay-at-home orders and things don't have to do with just helping the hospitals so they're not too busy. It has everything to do with all hospitals, no matter how big, have a limited capacity. They have so many, and under normal circumstances, people become ill at a certain rate, and there's no difficulty taking care of those people. If we have a large influx of patients requiring hospitalization or treatment from COVID, if you are at home and have a heart attack, or if you have a stroke, or if you have some other illness that requires hospitalization, if a hospital or health system is overtaxed, people with those type of illnesses can die as well because they are not able to be treated in an expeditious and efficient manner. So I think that's the whole thing that we're talking about.
The less cases we have here, the less chance for those that are really vulnerable to contract it, and you know, they have the worst consequences often.
Very true. I'm just going to go to the questions. I think, Sue, there's one I just saw. You know, I see them and then they go away. Here we go. For Sue, regarding contact tracing, Door County will likely see an influx of tourists when the order is lifted. Many stay for a couple of days, 3 days, and would be asymptomatic. They may return home and get sick or tested in another state after visiting here. Would a lodging owner be contacted if someone stayed at their establishment that then tests positive out of town?
That's a really good question.
Yeah.
So the short answer is that we're in contact with other health departments across the state, as well as we'd be contacted by our state health department if someone from another state needed to contact us. We'd get the message. But backing up a little bit, you know, contact tracing is a fancy term in my mind for what we've always done at public health, and that's follow-up and investigation of communicable diseases. So we're real familiar with that. We're just not so familiar with COVID, although we're all getting familiar. And what it means is public health follows up with everyone who's diagnosed. We ask them about symptoms. We discuss that diagnosis with them, what isolation means. As far as when we ask about symptoms, we ask about when they became symptomatic. And it's known that the infectious period is for a couple days before you get symptoms. So we discuss during that time who they've been around until either they're out of isolation, if the diagnosis is made after they're out of isolation, or up to the diagnosis and then they're put in isolation. Who they've been around, what they've done, and there's a definition of close contact, and it's not necessarily everyone you would see on a given day. It's if you've been within, okay, I have it written here, but where did it go? It's if you've, Thank you, there it is. Close contact is defined by the CDC as being less than 6 feet of a COVID-19 case patient for a prolonged period of time. Maybe it could mean close contact while caring for, living with, visiting, or sharing a healthcare waiting area or a room. So, and the other thing is, if we're wearing a fabric mask, that might not be a contact. So there's a lot that goes into a contact investigation and tracing, and I'm not sure if I'm even answering the question, but
No,
I
you
sure
are. In
described
fact,
a lot.
You don't know this, but you're answering two, because
Okay.
someone just before that had asked about, do they only contact people who have been within 6 feet of the person in comparison to everyone, say, at their job?
Mm-hmm. Yes, yes.
So yeah, you did answer the question very nicely. Are you able to tell us if our long-term care facilities have been impacted by COVID? Sure, they have not. They have not so far, thankfully. I mean, that's something that we hear, and I know the facilities, Scandia and Sturgeon Bay Health Services, Algoma Long-Term Care, and ours, spend a lot of time planning and working through that. And so far, everyone, in fact, the long-term care centers they were the leaders when it came to locking down and keeping visitors out, because you really do have a confined space that those folks are in.
I was thinking they haven't been affected by the virus, but they've certainly been impacted by, no visitors and no congregate meals and activities, and that's really difficult, I'm sure.
That's a good point.
Yeah.
Someone asked, why is our reporting lagging 24 hours from the state's reporting? I'm not sure if that's lagging on social media or...
Yeah, I'm not sure exactly what they mean by the question, but our numbers are going to differ from the states, and it has to do with partly when they determine those numbers. So as I understand it, 9 p.m. tonight, the numbers for the state will be determined for tomorrow, and they report those at 2 p.m. And the reason for that is they spend the morning making sure they're deduplicating so that they're not, they got all the numbers straight. So there's that lag time. And our numbers are from, our numbers that were reported today were from 4 p.m. today, and that's when we put our situation report out. The numbers for the state also depend on whether we have closed out our cases. And we may know that a case is negative, but if that nurse hasn't had a chance yet to send it to the state to finalize, cross all the T's and dot all the I's and send it off to the state, it might not be in their case count. And I'll just, while I'm thinking about it, refer everybody to our situation updates on the Door County government website. We also put that on our Facebook page. Other sources for information are the Wisconsin Department of Health Services website. So we put our situation report out and our numbers out. The situation report is Monday, Wednesday, Friday for full information. The numbers we put out the other days of the week, Tuesday, Thursday. So Monday through Friday we have something updated on our website. On the weekend, the Wisconsin Department of Health Services updates all the case numbers, including the counties. So you can look there for some information. And they have references to the CDC, and then, other accurate information is certainly Door County Medical Center website and Facebook page, and I highly recommend those. I noticed today on the state there's something new. It's called the Bounce Back Dashboard, and it looks pretty interesting. But I just glanced at it, and that's all.
Yeah, on the Door County website as well, we have a link to public health, and it's really works slick as far as being able to start with what we have and link to public health. Let's see. Someone asked the question, and it was a good question, and I'll just answer it quickly, and then you tell me if I'm right or wrong. Can we get the number of positives on visitors in Door County as well as locals? And my gut response is no, because we don't know where they're from. If they come up here and they're positive and they go back to their home state or whatever, we would have no way of tracking that. Is that correct? Other than contact tracing if they were...
Right. It goes by county of residence, and that's where that case is counted. But let's keep in mind that, if you're worried about somebody traveling here that's positive, first of all, if it's known that they're positive, they're going to be isolated and they're going to be told to stay put and in isolation. And second of all, if they come here and they develop symptoms and they get tested and they go home or whatever, that contact tracing is going to help us know about it and let everybody involved who had direct contact that's of concern know.
Someone asked, are the cases that have been confirmed in Door County all recovered? The ones that we have, that I should say that the public health has been following, have all recovered except for the 2 that have unfortunately passed away. The new ones, we still don't know the details as yet. I guess I want to, I'm going to go out on a limb and just sort of say, I think one of the things that's important for people to know is, we hear a lot on the news, and there's some questions relating to, Sweden is not shutting down at all, and they have 2,000 deaths. I guess for what it's worth, I'll just point out to you that the 2 patients that have passed away, have died, these are the sickest patients I have ever come across in my almost 20-year career. And that includes at large hospitals. It really gives me a healthy respect for, we talk about how the vast majority of people who contract COVID they may feel terrible, but they will have a benign illness and it'll recover just like most of our cases have. But if people get sick from this, it can do all kinds of things to the body. And, I am just privileged to work with probably the finest nurses. I shouldn't even say probably, because it's absolutely true. The finest nurses I've ever worked with, and respiratory therapists and pharmacists and things like that. I work with the finest folks that I've ever worked with in my career here in Door County. So, when I hear that, Door County used to be a Band-Aid station many years ago, that was many years ago. I've worked in big hospitals. These people have been very, very sick. So I'm pleased to say that most of the people have recovered. Mm-hmm. But I think, at least in my mind, that was important to point out because you hear so many different things. Concept of, someone asked about Sweden, is that something that could happen? It's such a complex, it's a real complex thing to talk about. Would you just do what Sweden has tried, do herd immunities, let people get infected? The difficulty is that people will die of this because everyone has a variable course. I sort of tongue-in-cheek will ask folks when I'm talking to them, can't we just do herd immunity? I sort of say, well, are you going to be the one to take one for the team? Because if you take herd immunity logically, the minute you get short of breath, what's the first thing you're going to do? You are going to run to the hospital and you are going to plead with someone to help you be able to breathe better, because nothing is scarier than not being able to breathe. So when we talk about that, it's not just as simple as saying, gee, why don't we just let herd immunity work? Someone else earlier had asked the question about, is this just going to be our new normal? Are we going to have people come in that are sick even when we open back up? And I think the answer is yes. I think like any other, people still get influenza even though we have an influenza vaccine. I think that as time goes on, perhaps, and this is completely conjecture on my part, perhaps the severity will decrease. As we are all exposed in varying different ways, our body may have better ways to fight this off so that we don't get as sick. But I do think we'll be seeing COVID, for the foreseeable future. The vaccine possibility, the quickest vaccine that's been put to market was, I think I said a few weeks ago, was 4 years for the mumps virus back in the 60s. I think Ebola, as it turned out, was 18 months or so. We still don't know that a vaccine will be effective. We still don't know how effective it'll be, if it's effective. So like influenza vaccinations, it's very effective. It does prevent hundreds of thousands of deaths. but it's not a complete or perfect vaccine. It doesn't prevent from ever having it. Smallpox is a great example of a vaccine that no one gets. That's why we've eradicated it. Polio, for the most part, that vaccine has completely killed that virus. We haven't gotten so lucky when it comes to things like influenza. Let me see, go back to some questions here.
You're reminding me how we all, myself included, want to get back to normal, and I don't know when that's going to happen, and that's really the hardest part. If somebody could tell me.
It is.
If you had a crystal ball, I would appreciate that.
Yeah, I know, right. I will say to that point, and there's been a number of questions that I've seen on that, which is I'm just scrolling looking for it specifically. But the gist of the question basically is, when will we be able to start coming in and having, here we go, when will appointments resume to see our doctor for a non-emergency situation and or testing? That's a good question, and I know I keep saying that, but it is. I think we're going to be, and all of us, and all healthcare systems basically in the state and around the country are beginning to exercise plans to begin to open back up, to doing those routine visits, to those routine lab work, those kind of non-emergency appointments. We're looking to be doing that probably around next Monday to next Friday. We're going to start opening up slowly to some elective surgeries, and we have quite a plan in place for how we manage that. We also are going to open up the clinic appointments. We're going to try and start slow because it's not so much that our clinicians can't see patients as they normally did, but we're trying to abide by social distancing, trying to avoid congregation in areas like waiting rooms at registration, so we're working through some of those pieces. But I think the biggest thing that I'd like to say and point out is, the hospital is even though the idea is that it's where all sick people are, the hospital is a very safe place to be. It's clean all the time. We keep it clean. Our environmental services folks are just outstanding. They're top rate in the country, and they keep this place very, very clean. So if you're ill, if you feel as though you need to see your clinician, or heaven forbid if you have an emergency or you need to be seen in urgent care, don't hesitate to come in and see somebody. What we really don't want to see is you get super sick before you come in. We don't want to see people at home. If you normally would come in now. In fact, I printed this out because I thought this was so nice. Someone had commented on one of the sites that we have. A patient specifically said this, that they were apprehensive about coming here because of the virus, but inside everything was constantly wiped down, including chairs, counters, pens, etc. I wouldn't hesitate coming. And I thought that was really nice that someone commented on that, because I think that is that is the truth of the matter. And obviously, if you're not ill and don't need to come in, stay home. That's great. But if you need to come in, we'd love to have you come in and make sure. And that's not just for us. That's for Aurora, for Bellin. However, they're opening up. I think it's the same thing. I think healthcare organizations in general are not places you need to be afraid of. Let me catch up on questions as I'm babbling incessantly.
I was just thinking, as you were talking about how the hospital is preparing to open up more, our business community is doing the same thing. And, what does opening businesses look like in today's world? And there's a lot of considerations, the social distancing, putting up plexiglass maybe, who wears masks, hand washing, what's expected of consumers, all of that. So trying to navigate that is tough. Public health has been, to some extent, beginning to work with the businesses, and Ryan Stevens from the hospital is part of that, so that's working out really nice so far. We can't foreshadow how it's all going to work out, and beginning.
There's a couple of interesting questions I'll try and lump in. One was, do you retest to determine recovery? That was one. And the other question was, are you immune if you've had the infection, are you immune? So do you retest to determine recovery? In a general sense, the answer is no. In medicine, there's a concept that we call test of cure, and there are many things that we will do. As a crude example, a sexually transmitted disease. If someone is positive, we will treat it with antibiotics. We will test that to make sure that there's cure. If someone has a urinary tract infection, we do not test of cure. If the symptoms go away, the assumption is that it's taken care of. At this point, as far as we know to this date, we don't retest for cure. And one of the reasons is we've had personal experience with one who's positive and has retested for various reasons, and they continue to be positive, and that leads to questions that we can't answer right now. Is it because there is dead virus that the test picks up? The tests that we're doing in this day and age are called PCR tests. They basically sense DNA. They're able to sense, is there DNA or RNA from the virus in that specimen, in the swab specimen. So we don't know if the DNA that the PCR test is amplifying, is picking up, is dead virus, if it's a live virus. And so then that takes it to the next question, which is a person still infectious? We don't know. If they have no symptoms, are they still infectious? So it doesn't necessarily tell us. And similarly, are you immune if you've had the virus? Unfortunately, like so many things, we don't know the answer yet. I mean, we kind of are thinking that if it's like other viruses, yes, to some degree, you will develop some immunity to it. But it's kind of like the common cold. We get the common cold, and we aren't immune to the common cold for the next year. I mean, most of us get a cold annually or sometimes more. Now, that can be a different virus, but it's not necessarily that you're immune to it. I think once the concept of again, this herd immunity is once people are exposed to this, I think everyone's body will go to work and start developing antibodies to it, and there will be varying degrees of immunity to it. So perhaps the COVID-19 that people will experience next winter perhaps will be less severe. Again, just conjecture. We don't really know that because people have been exposed. That's another reason also for trying to expand the testing. If you watch the press, a lot of the stuff at a national level, state level is trying to increase the capacity to test. And the reason for it is we need to know if a lot more people have this than we think. Because right now, based on our testing numbers, we know that there's this amount of people that have the test, that have the disease. There could be this many people that have the disease. We just haven't tested that whole other group of people. If this many people have the disease, there's been a lot more exposure out there than we understand and than we realize, and the death rate would not look as scary, first of all, and would suggest that a lot more of us have been exposed and we've just fought it off and had nothing.
So I'd like to add to that question about when are people recovered from the public health point of view.
Yeah, that'd be great.
So in our numbers, I said that we've determined 7 people have recovered, and we don't go by testing, as Dr. Heise just went over. There's parameters that have been set up by Department of Health Services and the CDC. If you're at least 7 days after illness onset and have had 3 days of no symptoms, you can be out of isolation. So that's what we go by.
Okay. Someone had asked about looking at, there was an article, I think it might have been in one of the major, like New York Times or Washington Post last week, about low oxygen levels as being maybe one heralding sign of COVID, and should that be something that we should look at? I think that might be what the question was getting at. And what we have seen is that people will tend to, because if the lungs are, the lungs tend to be where the infection tends to start or tends to affect or exert its effect, the oxygen level will be lower. And so there is some thought that perhaps checking everyone's oxygen level that might help detect. Now, if you're seen by a clinician, your oxygen level is checked pretty much every time. And I know certainly in the emergency department and urgent care, we're checking that. These days, I think they're probably sold off the shelf quite a bit, or they're sold out. You can buy home pulse oximeters that you put on your finger, and it actually will give you an idea of what the number is. So that's kind of where we're getting. The other thing that's been interesting is so much discussion, and there continues to be so much discussion at a national level about ventilators. Do we have enough ventilators? And everyone's making lots of ventilators. Well, I think what we are understanding more, and certainly our experience has been, ventilators is probably the last, or using a ventilator, an invasive ventilator, so a tube down your throat, down your trachea, is the last thing you want to do. You want to absolutely exhaust all other possibilities for treatment before you would decide to put a breathing tube down, because we know that the mortality for people that have been put on a ventilator is about 80 to 90%, which means you have a 10 to 20% chance of surviving. So we have other means which we refer to as non-invasive ventilation, which is CPAP, BiPAP. I saw someone comment to that effect. High flow oxygen. So we're really utilizing those as are most folks in the country at this point. My husband has severe allergies. I'm assuming the question stopped, but I'm assuming, how do you know? And that's a tough part, is allergies and the spring colds, is how do you know that it's not COVID? And the answer is you don't. When it comes to allergies, when I used to be a primary care physician, I used to ask the question, do you feel sick? Do you feel crummy? Because typically with allergies, you may be bothered by the symptoms, runny nose, runny eyes, things like that, but you generally don't feel ill. With a cold or a flu, you'll feel ill. But even without that, if you're concerned, if you think maybe that it's possible that you have COVID, I encourage you to call the hotline and talk to one of the nurses that's there. I think the phone number is 746-3700. And again, that's open every day of the week, 8 to 4:30, and we have our testing site over at the dental clinic. And we can get you tested, because the only people that we're really not testing right now are people that have no symptoms at all. And that may change as well. But pretty much if you have any symptom at all and you're concerned, you can get tested. Let's see. Can you explain once again the reason for masking in relation to who it protects?
Sure. So we should all be wearing fabric masks out in the community, and that is not to protect us, it's to protect everyone we come in contact with, because that fabric mask will keep our secretions from going out into the world.
Yeah, it's the keep your spit to yourself phenomena. So it's.
I knew you'd explain it better than
well,
I
I
did.
know. I
Thank
mean,
you, Jim.
that's how my brain works. Is the closer we get to the third grade level, the better my mind tends to work. So keep your spit to yourself. So it's the concept of it. It's respiratory droplet spread, and so as we talk, if we spit or if we I could be talking to Sue and all of a sudden, without even realizing what I'm doing, go like that, and that would put something forth, and so the mask helps that. And I know it's confusing, because when we first started this, we were on this very same Facebook Live telling people, if you aren't the one coughing, you don't need to wear a mask, it doesn't help you. And that obviously has changed, and that like so many things with this, we're learning things as we go. And I don't think the original assessment of it doesn't help you so much was incorrect, as much as it is, we're looking for any and all ways we can mitigate this disease process.
You're right, things are changing so quickly, and we don't have a roadmap for this. My newest best friend is Dan Kane, our county emergency manager, and he likes to remind me a couple times a week that the last time we had something like this was in 1918, and they didn't keep good notes about it.
Right, that's true.
Yeah. And I appreciate that reminder, Dan.
Somebody was asking the question, I'll just throw out there, was asking what's a normal pulse ox level, which is, and again, pulse ox just means pulse oximetry, the percentage of oxygen in your blood, and it can be picked up just by a light transducer on a pulse oximeter. Normal, it doesn't need to be 100%, 95, 96% is normal. 88% and below, that is the Medicare and medical criteria for requiring oxygen. People that have things like emphysema, COPD, things like that, they can live about 89, 90% just fine, and we don't want them higher than that. So it's not as simple as saying this is normal, this is not. But certainly if you have one and you're below 88%, that's a problem, and it should be addressed. Let's see.
So,
Yeah, here's this is good, and I want to point this out, and I appreciate Stephanie. Stephanie comments here. Spoke with an employee of DCMC, asked them if they were at all nervous about working. She responded quickly, absolutely not. I feel safer at work. Everything's clean. Chairs, countertops are wiped down. That's kind of the way I feel too. I mean, I really do. I think if we're all smart, my wife will tell you when I walk in the door from the garage, the very first thing I do is I go right to the bathroom and I wash my hands for 20 seconds. That's just what I do. I don't take off my clothes and burn them. I don't do anything like that. I mean, and this has been going on now for, 5-6 weeks. So, again, and I say that, I always worry that I don't want to sound like I'm, flaunting, come and get me COVID. Not at all, but I trust myself that I'm being smart about it. The other thing that I know I saw in here is people were saying, what can we do, or how do we deal with those businesses that refuse to enforce social distancing and masking? I don't know, and I'll let Sue answer in a second if she has a thought. I don't know that there's a good answer to that. I think if we all do our individual part, if you're going to go to the store, I think wearing a mask is smart, because not only are you protected, but you're protecting other people. And I think that's a big part of this that Sue and I were talking about before, and it struck me, it was quite eloquent, is, I think in general we're used to ourselves and how do I not get sick. We really, in COVID land now, we're looking at how do I not only not get sick myself, but how do I personally not present a risk to everybody around me? So working here in the hospital, what if I have it and I don't know it? The way that I can do my part and mitigate that is to wear a mask in public, to wash my hands, to cough into my elbow, try to avoid touching my face, which is the single hardest thing I do on a daily basis, is not touching my face. Those are the things, and so it's not just about you personally getting sick, it's about how many other lives you might affect by making choices. I don't know if you have anything to add about that.
So, I'm not sure if I do either, to tell the truth. It's a really big can of worms.
Yeah.
How do we get businesses to comply? My general sense is all the businesses in Door County would not want to have COVID and would not want to spread COVID. And so, I'm assuming they're going to be very responsible about this, but is each employee doing everything they can? That's really a hard question. Are they doing as much as they can, or are they doing what they need to? And in some communities, they're looking to public health to do some sort of monitoring of that. I don't see how that could be possible practically. I'm struggling here.
Yeah.
It's a really hard question.
It is, and it kind of, I guess the way that I look at it too is what I see. You see so much in the press, and it is obnoxious, the different, the different spins on this, and on the one hand, people will hear people that'll say that our liberties are being trampled on by having us locked down, and I understand that point of view. And sometimes the very same people that say that will say, why aren't we making this business social distance and wear masks? So sometimes it's sort of a logical inconsistency, and we're all human, and we're all subject to those logical inconsistencies. And I think what makes it so difficult is, in many cases our livelihoods are impacted. We're not making money. and or our hours have been significantly cut back. And I consider myself very lucky to have a job and to be working. I can only imagine what that feels like to not know if your next paycheck is coming. So I think, at least here in Door County, I feel very confident and firm in saying no one that I have come into contact with or dealt with in government, in industry, public health, everyone is trying to do the best that they can. I have every confidence, and I say that with conviction. Everyone's doing the best that they can, and we're somehow going to get through this, and it ain't easy, that's for sure. I wanted to just answer one question because I think this might be helpful for others. One gentleman had said, I have COPD, which is basically, it's like an emphysema, chronic obstructive pulmonary disease. I have COPD along with immune deficiency. I've not had a temperature, but I have intermittent breathing issues. My oxygen level is 94. Would it be prudent to be tested? And those are always tough because anything I'm going to say may be right or wrong. I think my general take on what you've said is, hey, you got COPD, you got to be careful because you are at risk. Anyone that has COPD or lung issues, asthma, those things, you are at increased risk. I think if you have intermittent issues, it comes, it goes. It gets worse, it gets better. I don't think that testing for COVID necessarily will help you because, again, we're not testing asymptomatic patients. Would it be wrong to be tested? No, not at all. I think it makes more sense if where you are today you feel differently than where you felt yesterday or last week, and it's persistent. If you say something's up, most of us have a pretty good innate sense of saying something's not right here. I mean, I was this way and now I'm this way. Then I think it would be reasonable to be tested. I hope that makes some degree of sense.
I'm going to circle back to the business question that I couldn't answer, and I maybe still can't answer it, but going to take another stab at it. You raised a very good point, whoever asked that question, and part of the answer is that's why we want to work with businesses and provide the education and the guidelines and support. And public health is by no means the only agency concerned about this. Our county leadership, the business community, as I said, Door County Medical Center, Brian Stevens is in on this conversation. So we're all trying to navigate that, and it is so important that we try to work together because we're coming at it from different perspectives, and I've seen already that the health perspective can be a lot different than the business perspective, but we got to be on the same page as a community.
Here's a question that's kind of, the sentence is cut off, doesn't make sense, but I think I get the gist. This is a something or other, and I feel like you were talking to us like it's very small, like the COVID thing, like it's very small. Look at what's going on in Green Bay right now. And I would say if I made you think that this is no big deal here in Door County, that's not the message I'm sending at all. I think the point that you made about look what's going on in Green Bay, precisely. That's why I think the concept of continuing to be vigilant and wearing a mask and washing your hands and doing all those things that are important are crucial. Someone had mentioned about businesses. The fear is that businesses are not. The fear of businesses not complying is caused in part by the outbreak at JBS. Absolutely, and I think that's. And the thing that you have to understand too about JBS is that that's a meat packing. There's people that are really on a line. They're very close together. I know that our major businesses here in town are very aware. There have been conversations with them. They're very aware the last thing the local businesses want is for there to be an outbreak. So, I'm pretty confident in that. So no, if I gave it all the impression that it's not a big deal here in Door County, it's,
and I certainly agree. It's very serious throughout the state, throughout the country, I suppose. Yeah.
And someone said, all this is so overwhelming, I feel like there's no end in sight. And I think that's a really normal response. I think this is really tough because this is, I think we have to remind ourselves now that it's going on to 6 or 7 weeks or however long this has been. None of us have experienced anything like this in our lives. This is entirely new. We're in new territory. And trust me, I wake up every morning thinking, I just hope this goes away sometime soon, because it's draining and exhausting. But I think, we're all, and then, what can one say to make someone feel better, that tends to be my MO, is I want to be able to say something that would make a person feel better. I think we're all in this together, which might seem a little saccharine or a little trite, but I think it's true. We're all in this together. I think we're all going to get through it together. We just have to do the best we can, and I think connecting with our families via telephone, via FaceTime, Skype, whatever means you have, I think staying connected in that way makes a lot of sense. I'll tell you a funny little story is, I have a 13-year-old, and one of the big things with a 13-year-old is, he's a big Xbox player. He loves to play Xbox. And there's a game called Fortnite, which I begrudgingly, a while back, agreed to allow him to do. Well, he plays Fortnite, and he connects with his friends, his soccer team in Green Bay, friends, his cousin who lives in Janesville. He connects with people through this video game. So much as I'm not thrilled that he's playing video games all the time, for him it's social connection, and he doesn't feel like he's going buggy because he's talking to his friends and playing the game. So we'll take what we can get when it comes to allowing people to connect in ways that are meaningful to them. I think we're getting to a point where we need to wrap up. Let me see if there's any last thing.
I just want to say thank you again to Door County Medical Center for hosting these. It's
You
really
keep
great to
saying
be
that,
able-
and it is our pleasure. And I thank you for being here with me
You're
every
welcome.
week, because it's
Yeah.
it's so great to have the public health perspective.
And I don't want to be patting myself on the back, but I just want to give a shout out to the public health staff. They're working really hard.
Yeah, that is so true. And the public health department in Brown County and in De Pere, I mean, they are, their lives have changed immensely over the last week. And the CDC is on site, the National Guard is around doing testing. If you get a chance to listen on the morning news shows, Dr. Ashok Rai, who is the CEO of Prevea, is a colleague of mine, and we've worked together, and he is amazing and is doing a great job of communicating what's going on. And he's done a great job of taking the bull by the horns and really leading a lot of what's going on amongst the health systems in Green Bay. So, there might be a little bit of a shameless plug, but for them, but it's a fact. He does a really good job. So I think with that, we're gonna call it quits. We'll keep doing this as long as you'll have us, and as long as there's something to talk about. I know every week I appreciate so very much the questions that are put forth. They're all very good questions, and I hope that you found them helpful. I see a lot of kind remarks for us, and I really appreciate those. Those mean a lot more than you know. We really enjoy doing this, and if we're providing a helpful service, well, we're very happy to be doing that. Anything you want to say in closing, Sue?
I don't think so.
All
Thank
right.
you.
Thanks again for joining us, and we'll look forward to talking again next week. Have a great week and stay safe.